Hi, I'm John Jacobi. I'm an optometrist. I practice in Livonia, Michigan, about 20 minutes outside the center of Detroit. I'm here today to talk to you a little bit about treating patients who've had strokes. Patients who have had strokes have typically very similar traits. They have problems tracking print, their eyes are extremely dry, and many times they've had visual field loss. So what visual field loss means is as they're looking straight ahead, they'll be missing typically one half of their visual field, meaning that to their left, which is typically left, it'll be all dark. The unusual part of some of these cases is the patient doesn't realize it's missing. So getting around becomes difficult, getting through doorways, banging into things and people. Eating becomes an issue because they'll, for instance, be missing half their plate. Some of these folks still want to drive. So in order to attain that, we'll use special glasses that actually expand their visual field. So we take the visual field that's missing and we actually slide it a little bit over to the right so that they'll have their full visual field right off to the right side, and they regain function and they restore function enough many times to be able to drive. I have one patient who came to me, and actually her brother is an ophthalmologist, a vision surgeon, if you will, eye surgeon, and he didn't know what to do with her. And she was just beside herself. She was a mother who was in her mid-40s, trying to finish raising two teenage daughters, and they told her you wouldn't be able to drive, that she wouldn't be able to drive. So what we did is we made some very special glasses to address the fact that she can't see to her left. So we shifted all the visual field, we gave most of it back to her, enough where she could drive. The cute thing of the story is, she actually has a big farm and they have horses. And I said, before we get into a car and start driving with your new way of seeing, we're gonna have you use your riding lawnmower. So she used that for a couple of months, cutting her lawn and becoming aware of that side vision again, and she was off to running. And it's now been probably 12 to 15 years later, and she's successfully driving.